Great. Well, thank you very much to the National Collaborating Centers for hosting and inviting me to share on behalf of my team's work. The learning objectives for my segment of this webinar are to highlight the framework and performance indicators that we developed for public health emergency preparedness in Canada, and in particular to describe the essential elements that emerge in relation to resilience in the public health system in Canada, building on what Claire had just introduced related to resilience. In terms of the background to our work, which started much before the current context of a global pandemic, certainly emergencies, whether extreme weather related or infectious diseases, were seen as an important global priority. The Sendai framework is a landmark agreement which is seen as a companion to two other important global documents, the Sustainable Development Goals and the Paris Agreement on Climate Change. And there is more and more awareness on the importance of trying to better understand what health system capacity looks like for managing crises like these, whether infectious or non-infectious, including specifically relevant to the Canadian context, which was the focus of our work. We know, based on previous public health emergencies, as Claire highlighted, that the public health system plays a crucial role in community health protection, and we have unfortunately also seen the disproportionate impacts of disaster risks, demonstrating the importance of considering ethics and values in public health emergency preparedness activities. So it was with this lens that we wanted to consider public health emergency preparedness in Canada as part of a complex system in relation to resilience. The purpose of this research, which we undertook, was to understand how do we know if we're ready, and then how do we measure it? The idea of how do we know the idea of how do we know if we're prepared and then how do we measure it rose to the top of the priority list for research in this field in Canada. And this in particular was seen that in relation to local and regional public health agencies across the country, that it was really difficult to understand if they're prepared and how they can measure it to report back to decision makers. And so we aim to tackle this knowledge gap. We were fortunate to be able to be funded by the Canadian Institutes of Health Research to conduct a study to address this gap. And so the first two objectives relate to those two key ideas: to define emergency preparedness for the Canadian context by developing a framework for public health emergency preparedness, and the second objective to create a set of indicators for public health emergency preparedness using a Delphi survey. And our diverse research team and knowledge users were key to achieving the third objective and engaging knowledge users throughout the research process. To develop the framework, we conducted structured interview matrix focus groups in 6 sites across Canada. We collected data on multiple perspectives and from multiple types of organizations, conducting the focus groups with an interdisciplinary sample of participants working in public health emergency preparedness and related fields. From here, we analyzed the data in which we asked participants about the key and relevant dimensions of public health emergency preparedness in Canada. So specifically, in terms of the SIM method, to achieve this, the 3 rounds of the SIM are anchored around 4 questions that frame data collection, and these are the 4 questions that we asked participants from across the country. The questions generated different types of data, with question 1 and 2 identifying elements, and then question 3 involving more conceptual discussions, and question 4 generating discussion and data related to participants' experience in emergency preparedness and response. So to link phase 2 with phase 1 with phase 2, which was the development of indicators. In order to develop good indicators, as this NHS report refers to, the clarity that we aim to achieve in developing the framework was really important inform an understanding of what the system was aiming to do. And so that was really important that we developed the clarity and a shared understanding of what the system was aiming to do, given that indicators only indicate. An indicator will never completely capture the richness and complexity of a system. And so the process of developing the framework, it was really important that it was very rigorous and reflected perspectives from across Canada. And then that fed into an initial set of indicators, which we see as potentially starting the process of being able to measure public health emergency preparedness for local and regional public health agencies. The methods for developing the indicators, just in brief, are reflected on this slide. The unit of analysis and development for the indicators was the local or regional level of public health in Canada. And what we did was extract indicators from the literature corresponding with the elements of the framework, and then incorporated them into a consensus process, namely the Delphi survey method. What I will do now is to walk you through some results. Our results from the phase 1 focus groups resulted in the development of this framework, and our full framework is published at that reference listed on this slide. The framework consists of 11 essential elements, with governance and leadership as the cross-cutting element seen as encircling the inner 10 elements, and with ethics and values represented at the core of the framework. What I'd like to do is walk through several of the 11 elements that particularly focused on resilience in terms of what we found in the results. We did generate themes based on analysis of the full data set, but as I mentioned in terms of the questions, some themes were discussed more in relation to resilience, depending on the nature of the data collected. And in addition to themes, characteristics or abilities emerged also as important in public health emergency preparedness and resilience. So just to walk through a few examples. So governance and leadership was our theme, seen as cross-cutting and circling the other elements. The importance of integrated structures, partnerships, and accountabilities with clear leadership to support a coordinated, interoperable system. So coordination emerged as a key aspect of governance and leadership, with the idea of the importance of being able to break those silos down as being important to preparedness and planning, needing to do that in the preparedness phase as an important time to build those relationships. So to give you an example of an indicator for governance and leadership, which was developed in our phase 2, the public health agency is a member of a local or regional structure for health sector emergency management that aims to coordinate health system preparedness for emergencies. Partners in the network involved may include acute care, primary care, EMS, depending on the jurisdiction. The next indicator I wanted to provide an example with is collaborative networks. So the importance of developing relationships, partnerships, and strong networks was really seen as important to promoting resilience. Strong networks also enabled access to expertise for a range of hazards and impacts, and collaborative networks are enabled by memorandums of understanding and formal research. So through our focus groups in phase 1, participants described that it was that collaborative framework that was seen as contributing to make the public health system resilient. An indicator example for this element is the public health agency has demonstrated, the ability to perform cooperative activities with network partners. This ability may be demonstrated, for instance, during real or simulated emergencies. A really important example in relation to resilience was community engagement. So the importance as an essential element of understanding and engaging with the community. as a participant described in our phase 1 focus group, on the cultural side of things, if you're serving a community which has priority populations, in developing that plan, isn't this as much about reaching out to those communities through the process of planning and preparedness? So the idea of engaging inclusively with the community enables a consideration of community risks, assets, and values, and facilitates transparency. And the importance of being proactive in really understanding community priorities and values and considering community risks as well as risk perception, and the idea of the whole of society approach that Claire mentioned. An example of an indicator that we developed for local regional public health agencies for community engagement was that the Public Health Agency dedicates time for the continuous development of relationships with community organizations relevant to preparedness for those local risks and the agency context. So for example, building relationships with members of the public and or advocacy groups that represent the public. Workforce capacity was a really important one, seen as related to resilience in the public health system, as you can imagine. The importance of proper training and redundancy so that people are well trained, there's enough of them, and staff resilience coming from that redundancy. So the idea that well-trained and knowledgeable people promote resilience in the system, and how it's important to consider the public health workforce and responders in planning to promote business continuity, sufficient redundancy or surge capacity, and also staff resilience. An example of an indicator for this element is the Public Health Agency has established policies and procedures for supporting staff during an emergency with respect to their health and well-being. For example, their personal safety, mental well-being, and family commitments. And the last example I'm going to give in terms of the elements that I wanted to highlight in relation to resilience is learning and evaluation. So the idea of evaluation really as that strategy that can help you build resilience, being broader than feedback. So the idea of having an evaluation strategy on the ground to inform you as you go, and to inform course correction where needed, and how do you tell if that plan you developed is working. So the idea of evaluating response to single or multiple incidents, or even through practice of a plan, to assess and action improvements for better preparedness and response. And evaluation of preparedness and response seen as being key to recovery and successful if it's timely, prioritized, and invested in. So a specific indicator that was included under learning and evaluation, the Public Health Agency applies a self-assessment process to emergency management. And this process may be applied to tests, exercises, simulations, and or emergency plan activations and agency responses. So those are a few of the examples of the elements and the corresponding indicators for those elements that particularly reflected the data that emerged in relation to resilience. Some of the indicators also reflected dimensions of ethics and values. And ethics and values we did see really as at the core of the framework, as I mentioned earlier. We've incorporating ethics and values based on the literature and based on through our consensus process of the Delphi survey was important to really to start thinking about how to explicitly consider ethics in planning, because certainly when we did this work pre-pandemic, it certainly had already been documented that ad hoc decisions during evolving emergency situations can increase risk for some populations and reduce trust in the emergency management system. And so the idea is that by building ethics and equity into a framework for public health emergency preparedness, can serve to work towards incorporating fairness and values at the core of public health emergency preparedness, supporting upstream readiness and resilience. So in summary, in relation to what we found from our framework and for resilience in the Canadian public health system, certainly the themes that emerged in our data in relation to resilience highlight that collaboration within the system and with the community are essential elements for resilient systems. The connections within public health agencies themselves and their workforce are also really seen as important to resilience. The idea of resilience-oriented approaches is relevant to the public health system and really speaks to the need to prioritize the social infrastructure and characteristics that promote relationships, adaptability, and learning. In terms of next steps for the work on our end, we do aim to take forward this work towards and moving it towards quality improvement, capacity building, and we were successful in receiving funding from CIHR to pursue this work, which is paused right now during the pandemic, and we look to resume this work as in working with several public health agencies once the demands of the current pandemic response have become more manageable. And just to wrap up, I would like to acknowledge in particular the study participants that were crucial to the success of this project throughout all the phases, and my co-authors and colleagues who, and these are just a few of our key co-authors on the papers, as well as our knowledge user team. And that's it for me. Thank you.
Thank you so much, Yasmin. That was excellent. That's an awful lot of work, and you did that presentation really succinctly. So thank you for that.